Happy Saturday and welcome to the Jeremiah Patterson Show. Thank you all very so much for coming and joining the show tonight. We have a very special guest in just a few moments. But I want to start here with a question because most of us can relate to this. Have you ever been bitten by a mosquito? The chances are likely yes. I remember a couple years ago during like a family cookout, I was eating a cheeseburger outside and mosquitoes were swarming the whole area. Eventually we had to move everything inside because it was too much. But you know, mosquitoes are annoying. I mean, just the buzzy sound as it's circulating around your ear and getting closer and closer before it bites you. And then they come back for more. So imagine that, but on a more massive scale. And that's exactly what happened in World War II. These are some pictures here from essentially posters that were for World War II veterans. Keep your shirt on, soldier. Exposed skin after dark is meat for the malaria mosquito. Fight the peril behind the lines. Here's another one. Don't be a jerk. Don't get a mosquito bayonet in your behind. Keep covered from sundown to sunrise and use your repellent. There's a whole bunch of them. But this one here is my favorite. Watch out for the Chow Hound. She's Miss Malaria. So, fighting Germany and the Axis powers were not the only enemies during World War II. Soldiers were consistently being warned, essentially, to wear their shirts and to be fully covered at all times because malaria was really getting bad. There were more than 113,000 cases of the infectious disease among troops and 90 deaths reported. The United States Army alone reported an astounding 4,000 cases per 1,000 soldiers. It was just medically catastrophic. As this was becoming widespread among troops, there was essentially incessant pleas to do something about this. Our troops are dying and we're still fighting a major world war, which, if not won by the Allied powers, could shift geopolitical domination for centuries in the most negative way. So in response, the Public Health Service helped the War Department create the MCWA, Malaria Control in War Areas. Essentially, scientists got to work and they began immediately doing research on what was causing malaria, addressing the underlying issues on what was going on here. And by 1945, Congress had provided additional funding to fight malaria outside military camps as it was spreading in parts of southern United States. And that was immediately addressed too, and essentially a spray repellent was created that could stick to furniture to deter mosquitoes in homes. And one known fact of the world back then is that it was really disgusting. Things were really yucky. And, the FDA was created, of course, because, for instance, the way meat was processed in America and the lack of hygiene and cleanliness in meat packing plants was a major concern for how Americans were consuming their foods, because there was not much of a regulation on the way that corporations were doing things regarding food in the country. So the FDA was created. The FDA can now recall certain food that may be infused with diseases, for the American public. That is something that can now happen because the FDA was created back in 1906. But after the malaria outbreak, it was clear that we needed something specifically for diseases, an agency full of scientists that could research, investigate, and essentially issue guidance to the public. We cannot have another deadly pandemic like the 1918 Spanish flu, which killed more than 50 million people worldwide, and 675,000 here in the United States because President Woodrow Wilson wouldn't acknowledge how serious it was until he caught it. And so, after that disaster and this new outbreak among troops, malaria, on July 1st, 1946, the CDC was officially created. It began as a small one-floor building in Atlanta, Georgia, with a $10 million budget and fewer than 400 employees. But they made it work. By 1951, malaria was officially eradicated in the United States. We went from this to this in just a matter of 5 years. The agency instantly gained international notoriety for its work, an incredible team of ready and able scientists. And the following year, so just 1 year after malaria, was no longer a major issue in the United States. It was officially, it was good. And so by 1952, the CDC began publishing a new report called the MMWR, the Morbidity and Mortality Weekly Report. This was a distinguished health journal, regularly updated, available to doctors, medical professionals, and infectious disease experts looking to stay up to date on all that was happening in the world and here at home. The MMWR has been an imperative report during periods like the 1980 HIV/AIDS crisis. It was instrumental in the H1N1 pandemic in 2009, as well as the 2014 Ebola outbreak. It has been published ever since 1952. Not once have we not gotten the weekly MMWR. Until last week, when Donald Trump took office as president of the United States and ordered the CDC to stop releasing that report, to stop releasing that essential medical update. And also, while you're at it, CDC, disband your website. I mean, this is happening live right now, and as I'm speaking, we checked. While doing research for the show tonight, we found this notice on the CDC's website. Quote, CDC's website is being modified to comply with President Trump's executive orders. We are watching in real time the dangerous politicization of the most premier health agency in the world. It is trusted not just by millions of Americans and public health officials, but it is also trusted around the world. And key parts of the website have also been purged. Talk about a crisis in government. I mean, this is the CDC we're talking about here. The Centers for Disease Control, founded after a malaria outbreak, was killing and infecting hundreds of thousands of soldiers in World War II. Founded to effectively provide reports on diseases, on what we can do to prevent them. And Trump is silencing the CDC. Not just them, but he's also silencing the NIH, the FDA, and other health agencies to no longer publicly release reports or information to the public about anything. Research grants have been paused, including cancer research at NIH, as of last week, until the Trump administration reversed that decision. But we are watching a deliberate attack to science. You know, a deliberate attack to silence some of the greatest health institutions in the world. When we talk about everything that is happening right now, and just all that is happening right now regarding bird flu in this country and other things, which I'm going to speak about just in a little bit, I mean, it's extremely concerning because if we do not recall, under Donald Trump's first term as president, when the coronavirus outbreak became more widespread, he was literally telling people to inject bleach in their bodies to save themselves from COVID, because, you know, that's going to save yourself. If you just put bleach down there and you're behind, you'll survive. I mean, I tried it. The CDC under Donald Trump's first term was heavily politicized in terms of the agency becoming under attack by politicization. Scientists told not to say certain things. Scientists told not to release certain information. The CDC was heavily politicized regarding the coronavirus outbreak in the United States, suppressing real live scientific information and facts that the public needed to know about. That is what was happening under the Centers for Disease Control under Donald Trump, that dangerous politicization. That's why the coronavirus outbreak got so bad. That's why hundreds of thousands of people died in this country. That's why millions were infected from COVID in the United States, because the president of the United States was anti-science, anti-vaccine, and simply did not believe in the fact that these scientists at the Centers for Disease Control could do their job to report information to the public. The attack on science is not just dangerous for health. It is dangerous because it is the politicization of a key organization, a key group of organizations that keep the public informed on infectious diseases since World War II, since the 1950s, with the MMWR. The implications of that with them being silenced is utterly devastating. And the most horrifying part about all of this is the fact that it comes at a time where bird flu cases are rising in the United States. It is so serious that it's now cost the U.S. poultry industry $1.4 billion because multiple bird farms, chicken farms, and even cows are having outbreaks, as multiple states conduct tests on certain animals to see who else could be infected. Whole flocks having to be killed because of the infection. There are a whole group of farms affected in different states by the disease, with Ohio leading the nation. In Massachusetts, the disease is now widespread. You may have noticed the cost of eggs rising. That is now being attributed to the bird flu. As of right now, there are 67 confirmed cases of bird flu in the United States. 67 confirmed cases. That's what we have as of now. Of course, one reported death as of January 6, 2025. In England, there have been reported cases of the bird flu as well, where a human was just recently infected. That has now led to panic. Panic calls for the UK government essentially to develop a vaccination plan, as we're staying on alert on, this becoming, just assessing the risk from a scientific perspective on if we should be alerted about this being an epidemiological crisis or if we are going to elevate into a pandemic. Is this something that we should be concerned about? Is this something that we should be freaking out about? Should we watch the way that we are consuming things? Should we no longer consume, eggs or milk? Is that a cause for concern right now? We're going to get answers to that question live here in just a moment. But I want to talk about two more things, essentially, that puts a fine point on how dangerous we are in this era of politicization of health agencies in the United States. And that is these two guys here, Muhammad Oz and RFK Jr. These two people have been appointed to key essential roles in the United States government. Muhammad Oz, on your left, has been appointed essentially to lead Medicare in the United States, to oversee Medicare, wanting to privatize that because that's going to line his pockets because, oh wait, there's interest here in terms of money. That's going to make Dr. Oz richer. I mean, this TV doctor with these quack, inexplicable theories that have no substantiated proof to be confirmed to be true. He is going to be leading Medicare in the United States. And RFK Jr., the person that Donald Trump has picked to be the actual Secretary of Health and Human Services, which, by the way, oversees the CDC, by the way. The CDC is part of HHS. And Muhammad Oz is going to be over Medicare. We'll see. And RFK Jr. potentially is going to be over the Department of Health and Human Services, someone who has touted unsubstantiated false claims of vaccines being bad, while, according to his cousin, Caroline Kennedy, getting his own children vaccinated, but spreading misinformation about vaccines, including in foreign countries where that has had devastating impacts on children, on the lives of people there. Because RFK Jr. is influencing other leaders that, hey, you shouldn't get your people vaccinated. Vaccines aren't good. Someone who has touted the idea of, hey, maybe we should get rid of the polio vaccine. RFK Jr. potentially being confirmed as the Secretary of Health and Human Services, and Dr. Muhammad Oz potentially being over Medicare in the United States. I wish I could make this stuff up, but this is real. Watch.
Vaccine that is, safe and effective. I do believe that autism does come from vaccines. They're going to have the right to compel unwanted medical interventions on us. The Nazis did that in the camps. COVID-19 is targeted to attack Caucasians and black people. They're putting in 5G to harvest our data and control our behavior.
I really wish we all could collectively laugh together and just imagine that this is a dream, that we are in a deep, deep sleep. But that is not the case. This is real life. It is the year 2025. It is now the month of February, and Donald Trump is president of the United States. And he has launched an attack on the CDC, on NIH, and all of the premier public health institutions in this country. We also have recently withdrawn from the World Health Organization. And on top of that, I will also say there is another situation to be concerned about. Kansas now has the largest tuberculosis outbreak in the United States as of now. 67 active cases. Quote, the current Kansas metro tuberculosis outbreak is the largest undocumented outbreak in U.S. history, presently. Since the CDC was founded, basically going back to when the CDC started monitoring tuberculosis back in the 1950s, tuberculosis is a major outbreak now in Kansas. Since the foundation of when the CDC started monitoring this back in the 1950s after being founded for malaria. That is what's happening. We also now have reports of a tuberculosis case confirmed in Kalamazoo, Michigan, at a high school. Quote, health officials are investigating after a case of tuberculosis was confirmed at a high school near Kalamazoo. A person at Kalamazoo Central High School was recently diagnosed with active tuberculosis, Kalamazoo County government said in a news release. Health officials are working with school district to identify anyone who may have spent extended periods of time around the person with tuberculosis while they were potentially contagious. So as a nation, we are having to contend with this live, repulsive reality of these two quacks who are not actually qualified to serve in these health department roles, while also contending with the fact that we have major crises right now transpiring in the nation, with the evolution and the exponential increase in bird flu cases rising. But also now tuberculosis being the largest outbreak in U.S. history since 1950, when the CDC first started monitoring it, after being founded because troops in World War II were catching malaria. What does this mean for us in terms of us knowing what's going on, but also being in the dark because we have withdrawn from the World Health Organization? The health agencies in this country are essentially on a gag order. What does that mean for us, and how can we know what to do and how to understand the potential epidemiological effect of this on a wider scale in the United States? My guest tonight is Dr. Irwin Redlener. He's a public health expert and an affiliate at Columbia University. He has devoted his life's work to this, and that interview is next. He's going to answer all these questions and more. Astonishing time in America. Stay tuned. We'll be right back. So, I just wrote a book. It's called Resistance, a strategic guide on how to fight back, defend democracy, and avoid a Trump dictatorship. A lot of people have been feeling heartache and despair and despondency after the 2024 election, and that definitely is widely understandable, especially when you consider the guy who's literally about to be sworn in as president as someone who said that he was going to terminate the Constitution and be a dictator on day one. So in my new book, Resistance, what you get is 7 rules on how to defend democracy, to avoid authoritarianism, and how to literally fight back. It is compelling, richly historic, and a call to action. Resistance, out now. The link is in my bio. It's in my link tree. And once you click on the link tree link, you have like 3 different versions of the book pop up. Get your copy today. Dr. Irwin Redlener is a highly respected physician, public health expert, and advocate for children's health. He is the founder and director of the National Center for Disease Preparedness at Columbia University's Mailman School of Public Health. Dr. Redlener is also a professor of clinical population and family health and has dedicated much of his career in his life's work to addressing the health and well-being of vulnerable populations, particularly children in crisis situations. A pioneer in disaster and preparedness response. Dr. Redlener has worked extensively on improving disaster relief efforts and public health systems, particularly in the aftermath of major events like 9/11 and Hurricane Katrina. He's been a leading voice in the field of disaster medicine and the impact of crises on public health. In addition to his academic and professional work, Dr. Redlener is also deeply involved in advocacy for children's rights and the prevention of child abuse and neglect. He and his wife recently founded the Ukraine Children's Project just after the Russian invasion started there about 3 years ago. In addition to that, he's also co-founded the Children's Health Fund, an organization that provided health services to understand children across the United States. Through his years of service, Dr. Redlener has made significant contributions to shaping policies that protect and impact the lives of vulnerable populations. His expertise and extensive experience has made him a trusted voice in public health and disaster response, and it continues essentially to lead important efforts in improving health systems for future generations to come. Dr. Redlener is our guest tonight here on the Jeremiah Patterson Show, and he joins me now exclusively. Dr. Redlener, thank you so much for coming on the show. It's really great to have you on.
Pleasure to be here.
So, bird flu cases are rising across the country. There have been multiple reported outbreaks in states and among chicken farms, as well as, bird farms. And people are genuinely becoming concerned about the possibility of human to human transmission. How likely are we to see that in terms of the current state of where bird flu is right now? And should we be concerned about this becoming, I guess, an epidemiological crisis, or are we looking at more severe, like a pandemic?
It's not clear at the moment where this is all going with bird flu. First of all, it is definitely infecting birds, including domestic birds like chickens, as well as wild birds. And I think the latest estimate was that there were over 135 million birds infected. And there's a slightly different strain of that avian flu that is also infecting mammals now, like cows. And to get a pandemic or even a very serious outbreak that has human consequences, it's got to be a new virus that we've not been exposed to really before as a species. And second of all, it has to be able to be transmitted not just from the animal vector, as we'd say, meaning the chickens or the cows, but it has to be transmitted, as you said, Jeremiah, between and among human beings without the animal vector in between.
Mm,
So once it basically is able to spread from one person to another person, then we're into the zone of serious worry.
mm. So, in regard to the situation with the multiple outbreaks at farms and where lots of, poultry and dairy farms have had to do testing or to get rid of their entire flock, um, should people be concerned about consuming eggs or milk? Is consumption a problem, or do they need to stick, of course, to what CDC was previously saying was sort of like pasteurized eggs, pasteurized milk? Is there a concern for people consuming this and potentially contracting it?
And that's obviously a very important daily functional question for people. I mean, do we have to really go to the supermarket and worry that the milk we buy is going to be a problem in terms of carrying that virus? The answer to that right now is no, we don't have to be concerned, especially as you say, if we're drinking pasteurized milk and we have properly managed egg supply.
Mm,
What I would not be doing right now is drinking raw milk. I think there's a lot of reasons why we would not want to be doing that. And now, what we're seeing in terms of potential contamination with this virus is serious enough that, among other reasons, people should really stay away from raw products that have not been properly treated, meaning pasteurized right now.
mm. There was reporting earlier this week that there was sort of United Kingdom reporting their first case of the human bird flu. In terms of the situation with this around the world, because I know there were some reported human cases here as well as one death. Among humans, is there a way to sort of take precaution in our personal lives about how to go about this in terms of not coming into contact with birds who have been affected and or just not coming into contact with birds at all, but making sure that we're staying protected and protecting ourselves?
Right. So I'm going to divide the population into two parts for the purpose of answering your question. There are people that are directly handling poultry or mammals like cows or other kinds of poultry on farms versus the rest of us, who the closest I get to a chicken is buying a dozen eggs in the store. So I think the reality is for those of us who are basically the shoppers and consumers, I am not feeling alarmed yet. Really not at all. And for the people that work on farms, there is a concern that we are carefully ensuring ourselves that our herds of mammals or our flocks of poultry are not getting sick
Hmm.
and they're being monitored appropriately. Because that is something you want to catch at the earliest possible stages, because there's no question that humans can catch bird flu from poultry that they're handling.
Hmm.
And it's a very different category of concern than people like the rest of us who don't really have contact with live animals like that.
In addition to bird flu, another concerning report that we received recently was an unprecedented tuberculosis outbreak in Kansas, reaching historic levels. According to the Kansas Department of Health and Environment, they've reported 67 active cases since 2024, with 60 in one of their counties and seven in another one of their
Yeah.
counties as well. Um, Regarding public health and what's happening in Kansas, is there a need to be considerably alarmed about what's going on there and if that could become nationwide?
Um, this is a different kind of concern, obviously, than the bird flu or the COVID-19 pandemic was.
Okay.
And in the case of tuberculosis, it is definitely a concern, but I want to just mention some of the conditions that tend to expose people to the possibility of catching tuberculosis, a very serious disease that can make people pretty ill. And direct contact with other people who are either infected with TB or may have been exposed to it is something that we'd want to be cautious about. We don't have a lot of what we'd say endemic tuberculosis in the United States, even though we're getting cases crop up. But for let's say, people that have traveled to countries where tuberculosis is very widely seen, like the Micronesia Islands in the Pacific, and they come back and they've been exposed, and then they're living under challenging conditions of poverty and overcrowding, where they're exposed to a lot of people in tight quarters. Those people are at particular risk, and one of the things is when the CDC or the local health departments are tracking a potential outbreak in their communities, in any community, they need to get aggressive in doing screening for tuberculosis, both skin testing, screening people for symptoms that might be consistent with tuberculosis. And when you do that, you can really contain the disease, treat people that have it, make people aware who don't have it but may get symptoms that are consistent with tuberculosis. So it's manageable, really in a much more definitive way than the H5N1 virus bird flu infection or outbreak or other things that may be spread much with much more facility than tuberculosis. That said, it would be very, very foolish to ignore these outbreaks because they are serious public health threats, but specifically and particularly in populations where those conditions where somebody's been out and exposed in another country, they come back to very challenging socioeconomic conditions and so on. So that's where we have to really pay attention, Jeremiah.
Mm. When it comes to our premier health agencies in the United States, like the CDC, NIH, Health and Human Services, as well as other crucial agencies that provide reports like the MMWR from the CDC, as well as, just these essential health agencies in the United States. When Donald Trump became president last week, was it last week? Goodness, this felt like 10 years. When
Yeah.
he became president, when he became president last week,
I've aged at least 5 years since he became president.
I've aged a lot as well reporting. One of the first things he did was sort of instruct the CDC as well as these other premier health agencies to not report or release information to the public, essentially a gag order. When it comes to reports like the MMWR as well as bird flu, from your perspective as someone who has, devoted your life's work to this, what is the danger of politicizing our health agencies and the risk to the public in not getting that information out there?
It's, it's an incredibly dangerous and foolhardy guidance to give the CDC and other agencies. And it's not just the question of public information, it's the question of information for doctors who need that information to help understand what they're looking for, what they're screening for, what are the new treatments, what is the latest research that could help influence clinical decision making. It is mind-boggling that the White House and Donald Trump would want to shut off those conduits of information for people, and like I said, especially for the medical and public health community. I'm not, other than the attempt to kind of influence political, ideological objectives, it makes no sense whatsoever, and it is in fact really, really dangerous.
Mm. When we talk about the people that he's appointing to key government agencies like to oversee Medicare, Dr. Oz, who's known for sort of like insurance scams, and then Robert F. Kennedy Jr. to be the Secretary of Health and Human Services, a key department in our government that is huge with this incredibly uh, magnificent budget. And someone who is, RFK Jr., who's notorious for spreading misinformation about vaccine in other countries, leading to outbreaks there.
Yeah.
And when you speak about someone like that potentially being confirmed as the Secretary of HHS, the risk gets higher, but it also is sort of something that is stomach turning. It's repulsive to think about. Someone who is a known anti-vaxxer, someone who has been known to spread medical misinformation. I know you've been talking to senators and congressional officials up on Capitol Hill about this. What is your understanding of what's currently happening right now, and in terms of RFK Jr.'s potential confirmation? Is that a likely possibility that we should be concerned about?
One of the more nefarious things that the new president has done, he's appointed a host of highly unqualified or dangerous individuals to lead key programs or cabinet level departments in the U.S. government. And I'm just thinking about this past week. We were witness to hearings affecting the confirmation or not of the National Director of Intelligence, which he proposed, Tulsi Gabbard,
Mhm.
a known Russian sympathizer who refused to say that Snowden was, for example, a traitor under intense questionings by Michael Bennett and others. And then Kash Patel, one of the most unqualified individuals. I'm not sure he could actually get a regular job at the FBI, no
Yeah.
less lead the FBI. And then we come to Bobby Kennedy Jr. And the three of them, in different ways, represents threats to the structure of our democracy, to our national security, and to the public health of America. And by the way, it's more than America. The CDC is probably the most highly respected public health agency in the world, and we work hand in hand with the World Health Organization, which we may be withdrawing from, which is also
Yeah.
mind-boggling. But Bobby Kennedy would immediately take the authority and respect of Health and Human Services right off the cliff. It would just go away.
Mhm.
The man is a virulent anti-science, anti-vax, misinformation promoter that would wreak havoc on our reputation, but more than that, on our ability to deal with what's really important. He's proposed things like an 8-year moratorium on infectious disease research. You and I just finished a
Wow.
conversation about current infectious disease threats, and he wants to stop research for 8 years on these things. I mean, it's hard to know what to say or what to react to first. The problem is, and the reason I mentioned Gabbard and Cash Patel is the question. This is a political question now. I'm sure there are plenty of Republicans. For example, even the chairman of the called the Health Committee, which is Health, Education, Labor, and Pensions, who did the second set of hearings on Bobby Kennedy Jr. He's a doctor. I know him. I know he thinks that Bobby Kennedy is dangerous. Um, but the Senate as a whole, now in Republican hands, would they actually reject three of those high-level nominees by Trump? Or today, are they now meeting somewhere and saying, I don't know how we're going to deal with this, but are we going to hand our president three defeats? I don't know. In which case, there may be judgments being made that have nothing to do with the qualifications, let's say of Bobby Kennedy, but on how their political relationship with the head of their party and the president of the United States is going to play out. And then in the background, Jeremiah, which is something I don't know what we're going to do about this, but we have Elon Musk, this unelected, you know, person who's got, the richest man in the world, as everyone knows, with phenomenal influence right now in government. And he's going to get what he wants in many cases because he's threatening to primary senators or members of the House that don't go along with the president's agenda. So all of this entire brew of political realities, Trump's personalities, Musk's ambitions, or whatever they might be, is a long-winded answer to your question because I don't know what's going to happen.
Mm.
By all rights, Bobby Kennedy Jr. should never come near the Department of Health and Human Services. It's a $1.8 trillion budget with 81,000 employees. And his influence over American health policy and the research agenda is extraordinary if he were to get that position. And he just can't have it. So, the question is, should he get it or will he get it? And, hopefully not.
That is definitely an extraordinary take, especially when you consider it with like the confluence of national security and health being synonymous here. And, sort of Republicans worried about the political fallback of not confirming one, if not all of these nominees, and sort of having to play political gamble with this because all three of them are a nightmare if confirmed. But, the health department particularly being extremely concerning. We've seen recently a purging at the FBI as well as at DOJ. Um, my concern and sort of what keeps me up at night is the purging of career appointed experts at HHS and at CDC who could potentially be, wiped out if RFK Jr. is appointed, because he's even talked about, bringing in some people who have no actual medical experience into government. What is your sort of assessment of that reality becoming true?
And by the way, to your point, they could be fired overnight. I
Yeah,
mean, the Trump administration is not following the usual rules or laws that govern even how people are dismissed.
exactly.
Laws set by Congress. And there could be a, kind of a Saturday night massacre scenario like he did with Justice and the FBI. And I don't know who or what's going to stop him exactly. The usual guardrails are evaporating, and I don't know what could happen. By the way, you mentioned Mehmet Oz before. Mehmet Oz was a colleague of mine at Columbia University, where
Mm,
he was renowned as one of the best cardiothoracic surgeons in the country. And then I guess Oprah had him on TV, and then he got his own show. And before you know it, he is promoting absolute quack theories. He's
exactly.
had guests on his show telling people how they could communicate with the dead. We're talking about a guy who's so far out, so disjointed and disconnected from reality, who would be in charge of Medicare and Medicaid programs.
Mhm.
And that would be one of the senior members of the Bobby Kennedy team, I guess. And then David Weldon, the doctor who he would appoint as head of the CDC, still believes in the connection between measles vaccine and autism, a theory that has been so disavowed and disproved that it's almost ridiculous to even have to talk about it again. But there you go. We're facing a period of significant danger, and if there is that backroom negotiating among Senate Republicans about, like we got to give them one of these three people, it's like Russian roulette in a kind of a literal way, I guess, but it's a it's just a bad scene and unprecedented. It's such an overused word since Trump
Yes.
appeared in our lives that everything is unprecedented. God knows what'll happen tomorrow or Monday. I mean,
I
you
know.
just kind of, you know, you open your news feeds with dread every day now.
Yes, every day. Have you been in contact with Dr. Oz since his appointment to be over Medicare and Medicaid?
No, I
Okay.
haven't.
What has your conversations been like on Capitol Hill with senators in expressing their concern for RFK Jr.?
So I've been communicating mostly by text with a few of the key members, and in one instance with a very key member by phone. And I'm rather not talk about who specifically, but it were key people on the Finance Committee and the Health Committee.
Mm,
And it's, they're listening and they're reacting, but very in ways that I couldn't tell you what they actually feel.
mm.
You know, um, People that rise to that level of politics are pretty good at evading or saying what you want to hear. I don't know. I couldn't possibly. I don't know any of them well enough to be able to assess. It's not like I'm having dinner with them. I'm just having a conversation.
Yeah, yeah, yeah.
Yeah. But but anyway, yeah. No, we're really facing some very tough decisions, and I guess some of those votes are going to take place early next week, like in a 2, 3 days from now. I don't know. Maybe Jeremiah, do you know when the votes are going to? But I'm assuming I read somewhere that Kennedy will come up for a vote really early in the week. I don't know about the other ones. I'm assuming they're going to want to answer yay or nay on all of them sooner rather than later.
Exactly. Those confirmation votes are coming up now that the hearings are done, confirming many of them as fast as possible so Trump can have his cabinet in place. Lastly, I wanted to ask you about sort of how, if you've been in conversation with sort of like your other colleagues in health and how they're feeling at this moment, because I know when Joe Biden won the election, there was a collective gasp from the scientific community in terms of uh, real clear-eyed, logical information returning and no more health conspiracy theories being
Right.
elevated, and talked about at the podium in the White House. Has there been a sense of despair and worry that you've been hearing and communicating with your colleagues in health?
Very significantly so.
Mhm.
And I don't know there's a lot of conservatives in medicine and a lot of people that I'm sure voted for Trump. I haven't heard one voice in support of Bobby Kennedy Jr. as head of HHS. Not one.
Mm.
And I had a letter in the New York Times a few days ago, basically asking the question, where is the American Medical Association? That has not, I mean, it's the largest medical organization in the country, and they have not issued a statement opposing the potential of Bobby Kennedy Jr. being the Secretary of HHS. And so, from a formal point of view, and there have been petitions, 15 or 20,000 doctors have run in an organization called Doctors for America that have written to the Congress, laying out exactly what's dangerous about these nominees, and I don't even if there are doctors out there who are opposed to Kennedy, they're probably embarrassed to say so. So, but anyway, among my friends, as you can probably imagine, I don't think we have a lot of Trump voters, but I'm sure there's plenty in medicine in general.
Once again, Dr. Irwin Redlener, a physician, activist, a public health expert, and an affiliate at Columbia University who has dedicated his life's work to this. Dr. Redlener, thank you so much for coming on the show and explaining these matters in these dark and dystopian times. It was great to have you on.
Thanks for having me, Jeremiah, and maybe we'll have another conversation in the future, seeing how
Absolutely.
things unfold. I'm all yours. Yeah,
Thank you. I would love to have you back.
take care.
All right. That was our interview with Dr. Irwin Redlener, a public health expert who spoke to us exclusively here on the Jeremiah Patterson Show. I will tell you, I did not expect the ending there, Dr. Redlener sort of offering an invitation, a sort of an offer to come back onto the show regarding everything that's going to be happening in terms of health in the next week and with the potential confirmation of RFK Jr. So I will let you all know if I will definitely call him if there is something regarding that, which most likely there will be because there is so much that's happening here in the news. Thank you all so very much for watching this. I appreciate you all. Sorry for the delay in getting this published. I had to make sure everything was absolutely a perfection with this interview and the editing and the publishing of everything. But thank you all so much. I appreciate it. I appreciate all the support and the subscribers, and getting an incredibly valuable guest like this on the show was huge. So I appreciate all of you so very much. As always, be sure to follow us on Blue Sky at tjpsnews.bsky.social. You can also follow us at tjpsnews on Substack for the morning newsletter and a new exclusive paid subscriber-only newsletter coming soon from the Jeremiah Patterson Show. Thank you all. I will see you in a couple of hours, actually, for a couple of videos regarding news that's happening in this country that not enough people are talking about but deserves a lot more attention. All right, take care.